Good morning. I first would like to thank the rest of our planning committee for their work in preparing this workshop along with Alina. The committee included Terry Allen, John Auerbach, Ron Bialik, Christopher Holliday, Paul Jarris, and Sarah Linda. A list of the planning committee members and their bios are included in your meeting materials, along with bios of all of our distinguished speakers. We chose to organize the day around 4 topics: payment reform, the Million Hearts Initiative, as Paul alluded to, hospital and public health relationships, and collaboration in asthma, with the idea of exploring collaboration in the context of each of these topics. I should note, however, there are no neat boundaries around any of these topics, and many of our speakers could fit into multiple areas of these, and we hope that that does happen, as a matter of fact. So we encourage all of you and all of them to join in these conversations. We hope this will be a very interactive workshop, and to help with that, we've asked our presenters to keep the slides at a minimum and to focus on the process of collaboration. We have at least 2 collaboration experts on hand to help us ask some hard questions and help facilitate those conversations. And we are very pleased to have you here today. Jose, on to you.
Thank you very much, Julie. Good morning, everybody. Thank you very much for being here and welcome. Let me join you in thanking the other members of the organizing committee on this meeting, especially is Alina back in the room? Alina, thank you very much. When we start planning the session and discussing ideas, she kept us grounded. And when we went far away, she said, okay, but let's come back here. And at the end of the day, she helped us really get this as you're going to see it today. We're going to, so thank you, Alina. So when you look at this, and you heard George, you heard Paul earlier talking about integration, talking about collaboration, talking about how do we really impact population health. And we're going to be presenting here today through the analysis of 4 different cases, not just going into the nitty-gritty of how much we improve high blood pressure in a particular group of people, but how did we get there? How did we do payment reform, and this is going to be the topic in the next conversation, to use that as a driver to change systems that will impact population health. So it's transcending that initial conversation so we can really bring all of these other players. Part of this discussion, of course, personally, I look at it from the framework of government public health enterprise, or the feds, or the states, or the locals, and what we bring to the table, as well as our roles and responsibilities. But we are not alone in this field. We are not the only ones doing this work. And in some particular areas, nothing that we can propose or try to do will succeed without everybody else. That is what we want to come out in these discussions. Please ask the hard questions. So this is not just about celebrating the success. It's about learning how we got there and what the difficulties that we had getting there were. Because that is the part that sometimes we don't talk about. And not all of our successes we can just replicate, because our social, political, financial, cultural conditions are different at different levels of organizations, at different levels of regions or government or private sector. So it's trying to learn, decode those hard components and bring them here together. And as you will see, as Julie said, these are intertwined. So the 4 cases that we have for you today are not separate, independent, but they are not separate from the previous sessions of this roundtable. We cannot talk about payment reform if we are not talking about how do we finance the change. We cannot talk about the improvement in asthma if we don't talk about social determinants of health or housing. We cannot talk about improvement in high blood pressure if we don't look at the infrastructure for our healthy activities. And certainly we cannot have all of these conversations if we don't have a healthcare delivery system that really partners with everybody else. And there you see the integration of those 4 topics with the previous roundtable topics and hopefully toward the future. So we are up for a really exciting day. It will be as exciting as we want to make it here through your questions or your challenging of the speakers. So I am just warning the speakers on that. So again, thank you very much. And we're going to start ahead of time, which is really good. It's a big change. It's a big change. So let's move then to the first case. And to moderate that session, we have one of the members of the roundtable, Admiral Sarah Linde. I'm not going to read her bio, page 5 of the notes. Sarah?